Hi, Dr. Roseann here, and today we're going to talk about SUDS, or Subjective Units of Distress. I'm an integrative and pediatric mental health expert who's on a mission to change the way we view and treat children's mental health. If you're new to my channel, hit subscribe and turn on your notifications so you get my videos every week. Let's dive in. What is SUDS, or Subjective Units of Distress? Well, it's a way for a therapist to measure a person's level of stress, whether that's in person or teletherapy. So what is subjective distress? Well, it's defined as anything that's pain, discomfort, or anything that's causing somebody to feel uncomfortable. It's called subjective because it's a person's own personal experience. We can't define what each person feels when they're stressed. We can't define what stresses one person. We know that one person may experience stress in one way and another may not even see it as a stressor. So we have to always honor each person's experience. But what a SUDS does is it gives us a check-in system with our clients, with our kids. It's an amazing tool. And guess what? I love to teach it so they can measure their own stress, particularly before and after any type of stress lowering activity or therapy. SUDS can be numbered anywhere from 1 to 5, 1 to 10, 1 to 100. I don't recommend 1 to 100 because it gets to be too big, but I love to do 1 to 5 for very young kids, kids under age 7, and kids over age 7, including big kids. I like to do 1 to 10. It gives us a little wiggle room. With my visual in the teletherapy toolkit, it's something that parents can use, therapists can use, and in a session, therapists can pop it up onto a screen, and it's really helpful for kids to have visuals. You also can use your hand to have a child tell you what number they're at, whether you're a therapist or a parent. Asking for a SUDS measurement is so incredibly helpful for a lot of reasons, but it's really helpful for highly anxious people, individuals that disconnect from their body, incredibly negative thinkers, which we're seeing so much more of, who don't see the successes, don't celebrate those successes. It helps us to see where we're at, what effect the different treatments have had on us. So how do I use SUDS in a session or even with my own kids? So I like to start every session with a SUDS check-in. And what I do is I pull out my SUDS check-in, which is a 1 to 10 thermometer that's in my book. And what I do is say, where are you at with your stress levels today? 10 being the highest and 1 being the lowest. Sometimes people say 0, especially after they've done some deep breathing and biofeedback. And then what I like to do, if somebody were at a 10, then I say, what are some strategies and things that you could do? And this is really important to make sure that people have a toolkit and can do that. If somebody's new to you or you're a parent and you've never done this, you want to say, well, let's try to do some breath work. And what kinds of things could you do? You can do a 4-7-8 breath. In for 4, hold for 7, exhale for 8. Do that 3 times. You could do star breathing. I have lots of breathing techniques in my teletherapy toolkit. There are other videos about stress that you can watch on my YouTube channel. Having a pre and post check-in for a strategy. So maybe they're a 9. You do breath work and then do a SUDS check-in after. And it's really helpful for both you and as a therapist or a parent, but really for the child or teenager to see how much positive effect these tools and strategies can have on their own mental health. So remember, if you or a child you care about is struggling, it's going to be okay. I'm here to show you how to help children and teens feel calm, alert, and good about themselves. I want to hear how you're helping a child or teen? So drop it in the comments below. Catch you on the next episode of the Dr. Roseann channel, where we talk about natural and effective ways to reduce and reverse mental health.